So now we've saved the best till last, because in a lot of these presentations we talk about technology and what it might do, but we've now got a presentation on the views of clinicians and patients of using the technology in general dental practice. So Amanda Gallie will tell us what happens when you try and use such technology. Amanda.
Good afternoon, everybody. Thank you to Calcivis for having me to speak this afternoon. I would like to present the results from the field study, the beta test that we carried out in 2017. The overall aim of the study was to analyse the level of clinical satisfaction with the Calcivis imaging system, so we can elicit specific information from the clinicians via a questionnaire method. And we looked at lots of key determinants here, so ease of use being one, the diagnostic relevance of the image, quality of the image, and the efficiency of the device and software interface. And then very importantly, how using the device alters the behaviour. Are we changing what we do because of what we see? And we looked at this before the appointment, during the appointment, and at the treatment planning phase itself. So 12 clinicians were selected by an online process. There was a questionnaire that went out to lots of different organisations, and we ended up with 12 clinicians, 10 dentists and 2 dental therapists, of which I was one. And everybody works in very different settings, NHS and private and mixed practices, in a wide geographical distribution in the UK. And we ended up with submission of 180 images, which was great to work with. So I'll just give you a little outline of the task that we set the clinicians and the activity that they undertook. So 12 images were asked to be taken of permanent and mixed dentitions with a random sampling. The criteria for inclusion could be lots of things. We had sealed teeth, teeth with secondary caries, root caries, people who may have been using the ICCMS system, looking at lesions with classifications of 1, 2 and 3, and then looking around orthodontic brackets and appliances. And clinicians were asked to submit a completed questionnaire for each case. And then for the children, their parent or legal guardian was asked to complete a feedback questionnaire. We had a 50% gender mix, 50 males, 50 females. We had 31 paediatric patients, age range 6 to 16. 84 were young adults, and 40 were middle-aged adults, and 25 were older adults. This is a really interesting bar chart. So we've got 2 graphs here, one looking at early stage erosion and one looking at active non-cavitated or microcavitated occlusal caries. And we can elicit from this that 31% of patients imaged with the imaging system were newly diagnosed with active non-cavitated lesions. That's quite a large amount. So we're moving from the visual tactile method to using support of a device here. And that's more teeth being saved. And that's really, really interesting. If we look at the age ranges in the graph as well, so 37% young adults, 18 to 35, having activity. But if we look at the erosive lesion, that shifts to the left, and we've got a younger group, children under 18, having more erosive activity by the looks of things. And these would be themes that would be very interesting in research. So we did some word clouds just to show you some of the themes coming through. So a question that was posed was, why were you satisfied with the system after imaging was complete? So this is a clinician question. And it centres around trust, communication, prevention, having something to lean on to help you with the burden of diagnosis. So it's a huge responsibility. Perceived outcomes obtained were very clear images of various tooth surfaces. It makes invisible active caries and erosive lesions visible to you, the clinician, but also to the patient in the chair. It improves diagnostic confidence. It's comfortable for you to use as a clinician, and it's comfortable for the patient. It enables minimally invasive treatment recommendations. It improves motivation and patient attitude towards the provider because you're not wielding a drill at them. And the chances are you might not have to. It increases improved management of low dental caries risk and compliance, and education and communication with paediatric patients and their caregivers and parents. So determinants of dental professional satisfaction, I'm just going to pick out a couple of themes here. So improved patient comfort, improved patient-provider trust, and relationship building. That's really, really important in practice. Imaging, making the invisible active lesion visible, I think is really, really important. And I couldn't make my mind up on the last one because they're all really, really good outcomes. But improved dental caries and erosive diagnostic confidence, I think, for me, would be really, really important. So patient feedback was also really, really interesting. So it's brilliant. You can actually see what's going on with your own eyes. I feel that my dental checkup today has been the best I've ever had. So 82% said that Calcivis made them feel better about going to the dentist for their appointment, for their consultation. I shan't use the word checkup anymore after today. 84% said that it makes them more likely that they'll follow a preventive regime, which is really important. So this shows behavioural change. And 83% said that it improved their understanding of the disease process, and that's got to be a good thing worldwide. So the feedback there was very, very positive, described as pain-free, simple, straightforward, informative, and educational. So why were they satisfied? Well, obviously the big one that you can see is painless. But they think it's trendy, it's scientific, it's fascinating. It must be lovely as a layperson to come in and see a big picture of your own tooth, and it's there in front of you, and I'm sure it makes life much, much more interesting when you're having your consultation. But this is a really, really important shift into getting patients to be almost in charge of their healthcare, because they'll see it and they'll be able to make a decision, and it will be a shared decision, and that's what we're trying to move to. So in conclusion, clinicians like the concept. Clinicians find the equipment easy to use in the surgery setting. I mean, I can take an image in 2 to 3 minutes and have a discussion. It's really helpful, though, to utilise your DCP teams. You know, a nurse could do this for you, a therapist could do this for you, and you could analyse the data with that person. Clinicians find the diagnostic capabilities useful and very relevant in utilising MI principles in the treatment planning of early caries. So we're going to save teeth with a device like this. The image produced is clear and engages the patient. This enhances communication and may change home care behaviour. And then, very importantly, this elicits different treatment approaches from clinicians, such as fluoride varnish and sealants, because we need to be doing a lot more of that. So thank you for listening, and we look forward to your questions. Thank you very much.